Hello friends, welcome to English Shorthand class. Ready? 1, 2, 3, start. It is 2 months since Omicron was first reported as a variant of SARS-CoV-2. Since then, Omicron has been identified in 171 countries. It has become the dominant variant in many countries, and the world is experiencing the highest daily new COVID-19 infections since the start of the novel coronavirus pandemic. Alongside, there has been a better understanding about the new variant and its spread. Omicron is 3 to 4 times more transmissible than the Delta variant. Epidemiological data points to a decoupling of Omicron infections from the hospitalization and deaths. A majority of cases in nearly all settings continue to remain asymptomatic. Omicron causes mostly mild disease, at least in those fully vaccinated, and a surge due to Omicron peaks in 2 to 3 weeks with an equally steep decline. A medicalized response. Yet 2 years into the pandemic, many countries, especially high-income countries, are still struggling in their response to the Omicron surge. Part of the reasons arguably is a medicalized health system response and insufficient adherence to COVID-appropriate behavior by citizens. As an example, while 2 doses of vaccine continue to provide protection from the severe disease, hospitalization and deaths, administering a booster dose to keep antibody levels high is a medicalization of a public health intervention. Similarly, COVID-19 testing is being promoted to carry out routine activities of daily life, while there is limited public health benefit of such testing in halting transmission. These are examples of medicalization of the pandemic, and the list is really long. In this backdrop, it is not a complete surprise that spread continues unabated in some of these countries. In contrast, in South Africa, which first reported the Omicron variant, the fourth wave begun by this variant is already over. It clearly has some lessons for other settings. In the recent wave, in spite of the high number of cases, South Africa imposed minimal restrictions which were lifted quickly. In response to this wave, the country revised the isolation, quarantine, and the contact tracing strategies based on new epidemiological understanding. There were no reports of excessive use of blood tests, CT scans, or unnecessary medications or hospital admissions. Though schools were closed for a very short period, the government was equally quick in reopening schools. Following the Omicron surge, South Africa decided to introduce COVID-19 vaccine booster dose. However, a reason was that one of the vaccines being used in the country is a single dose vaccine with lower efficacy. Essentially, for that vaccine, a booster means a total 2 doses. As countries prepare to respond to the Omicron surge, there are two overarching messages. First, do not merely continue with the old strategies of test, trace, isolate, or treat, but review and update all public health policies to factor in new epidemiological and scientific evidence. Second, prepare for COVID-19 endemicity in your country setting. Ongoing third wave in India. India is in the middle of its third wave driven by the Omicron variant. Considering the many similarities with South Africa, such as median age, population density, health system, infrastructure, and natural infection rate, India is more likely to follow an Omicron wave trajectory that is similar to South Africa's. As the third wave is likely to affect Indian states in phased manner, states can benefit by putting the learnings so far into practice. First, considering the infection and hospitalization decoupling in this wave, the old indicators, new daily COVID-19 cases, and test positivity rates are not the best parameters for decision making. The new indicators to track the pandemic should focus on daily symptomatic cases, hospital bed occupancy, intensive care unit admissions, and a few more refined stratifiers of pattern and outcome of infection in high risk groups and non high risk groups amongst others.